I believe that dry eye is a multifactorial disease. However, the fundamental issue there is inflammation. We have an ocular surface that requires very precise homeostasis to maintain comfort, to maintain good vision. And when we have inflammation there, what happens is that homeostasis just gets out of whack. And in order to relieve those symptoms, in order to get our patients to feel and see better, we have to treat that inflammation. We have to break that cycle, and that's how we get our patients doing well.
Is there an inflammatory component to dry eye disease that kind of demands that we treat it? I think the answer is unequivocally yes. I think it's axiomatic now, it's just basic science that all of dry eye has at its core an inflammatory substrate. So whether you're talking about aqueous deficient dry eye or evaporative dry eye, there's some inflammation at some part of the process that's causing that disease to be a problem for the patient. Should we treat it? Of course. The only question is, how do we treat it, and for how long do we treat? If you're not addressing the inflammation on the surface of the eye in a patient who has either symptomatic dry eye or dry eye where the signs are so severe that it doesn't even matter if the patient is bringing symptoms to you, you have to treat that inflammation. It's a gotta, must, have to do.
Do I believe that there's an inflammatory component in dry eye disease that requires treatment? And the answer is absolutely yes. There is an abundance of evidence that indicates inflammation is a critical component to the development of this disease that we call dry eye syndrome. I'm going to give you some examples. We know that in dry eye patients, they have infiltration of their lacrimal glands with inflammatory cells. We know that their tear film has inflammatory cytokines, and we know that the corneal and conjunctival tissue has an increased density of inflammatory cells. There's an abundance of evidence that inflammation is pivotal in the development of dry eye disease. Now, the thing about this inflammation that's critical is that it is a vicious cycle. So in other words, the dryness that is caused by the inflammation creates more inflammation, and so we must treat it to disrupt that vicious cycle.
I do believe there's an inflammatory component. In fact, I know there's an inflammatory component to dry eye disease, and we as ophthalmologists must treat the inflammatory component, otherwise our patients lose faith, they lose trust, and their eyes don't feel any better. So by knocking out the inflammatory component, you're doing, in my mind, three things. Number one, you're gaining the trust of the patient. Number two, you're making them feel better quickly. And number three, you have the opportunity to then talk more about the chronic nature of the disease, and you have more credibility when it comes to establishing a rapport with your patient, getting them to comply with what you want them to do.